I just want to give a general update. My neck's been feeling a little better. I tried to sit in a chair, and that was a bad idea. Like even just for a few minutes at my computer, because my feet were hurting from standing all the time. I stand or I lay down, and I'm like, so I'm standing trying to do stuff, and I'm like, I just want to sit. So I sat down just for a few minutes, and my neck hurt from sitting, and I started to get dizzy. And I was just using I was like, I'm just gonna check my email, and then so I'll only be for a few minutes, and then and man, I started being like, whoa, like feeling dizzy, and then my neck was really like, then I stopped being able to like turn my head to the left easily, and it's awful. And I've been really struggling the rest of the day. I shouldn't have done that. I did, however, yesterday I went for a swim in the pool, just some like treading water and stuff, swimming laps, but really easy because I'm like I don't want to hurt myself. So I just did like I swam lightly, a couple laps, and then did some treading water and basically just kind of hung out in the water and enjoy it because it's completely supports my weight. So it's just nice to be completely supported outside and So today I went for a walk for about a mile. Then after that I sat down and I was just messed with my neck. It was awful. So hopefully tomorrow doesn't feel so bad because it's really starting to make me feel dizzy and it's very stressful. Also, my ankle and my knee are really hurting today. I was doing this stretch where like put your leg up, put your leg up and then stretch, point the toes like that, like stretch it that way, and then like that. But when I was pointing the toes, then I got up and I was like, God, like the top of my feet, like really hurt, and the right foot, every step I would take was just like, ow, like I mean the connective tissue in my whole body is getting screwed up, and it just keeps getting worse. I mean, it probably didn't help. I'm in bed a lot because like if I didn't have a neck problem and I had like issues with my ankle and my knee and stuff, I'd be at the gym all the time, like doing work, strengthening, doing all kinds of physical therapy for it. Um, but something's going on. Like I've something going on with me that's like, um, I don't know what it is. Like if it's Lyme disease, like I was watching a documentary on Lyme's, and because it can go into your connective tissue and damage it. I mean, one of the symptoms people get is like it'll uh, attack your collagen in your joints, and I don't know if it attacks it. I don't know if it like eats it or tries to destroy it, or if it just exists in that area and damages it by proxy. I don't know, but um, when I'm having it, like my right index finger is starting to hurt, like this middle finger right here. That's where when I pull out a drawer, I use that hand. Both of my thumbs, like when I open a door, sometimes I'll push with like my thumb. When I open the refrigerator, I'll push the door with my thumb when I pull the handle, and it hurts. And it's like all that, like it keeps getting worse, and it really scares me because it's like. Um, I, even if I fix my neck completely, it's like if the rest of my joints just fall apart and my neck falls apart again, it's like I don't know what to do. Like I'm gonna go try to get tested for Lyme's Monday, but I don't know. It's like pulling teeth. There's Lyme's and then there's like co-infections like there's Borrelia, and then there's like a couple other strains of bacteria that go along with it. But there's like different strains of Lyme's, and there's like Lyme literate doctors, but they don't take insurance, and it's like, and then trying to schedule with them, it's like, month long wait, months of waiting, and it's like I need treatment now, and I don't know. I'm gonna try to get some Lyme testing, but I mean something's causing damage throughout my whole body. It just keeps getting worse. I mean, my ribs are hurting like up under like like right at the base of the sternum and like down, like either side, but like on the rib itself, like I can feel the collagen, the tissue, right on it, and it's like I woke up one day and it just really hurt bad. I've been sleeping on a pillow underneath my torso, so maybe that put some strain on it, but like under my pectoral muscle, it's tender, and down the sternum where both uh, pectoral muscles attach hurts. My right shoulder was hurting when I was swimming. My left shoulder, of course, is frozen, and it's just like, and it's really scaring me. Like my left hip, which I did rehab on, seems to have been remained fixed. So I guess like I reset it through exercise, and um, but so whatever damage it had, it's still functioning well again. So I think if I could, perhaps if I could do more physical therapy and get stronger again, I could counteract it. But something is still causing damage, like bacterial infection or something. I mean, people keep saying, what if you have EDS? But I don't know. People with EDS, it doesn't seem like this, where they're just like, I mean, I'm noticing like week to week differences where it's getting worse and worse. And like, I mean, last year I could run around and do stuff, and like now I can't at all. So it's like, that's in 1 year. Usually people with EDS don't progress that fast. And I mean, if I keep progressing this way, I'm going to be dead in a few years at most. And it's going to be a very painful death. It's going to be slow, it's going to hurt, and I'd probably end up committing suicide before I died from this, because I don't want to lay in a hospital bed all day just waiting to die. And euthanasia is not legal. I mean, I don't want to commit suicide. I don't have any plans to. But, it's when you suffer this bad, it's like, if life's just going to stink all the time, what's the point? You don't want to live anymore. But I'm saying, like, that's why I got to figure this out. And I don't know. I mean, doctors are so reluctant to test for anything at all. Just they don't like testing, which is weird. They're like, doctors like, how do you know you have this disease? And like, how do you know I don't? Like, your job is to prove it. Your job's to figure it out. And all they want to do is say, I don't think it's that, and we're not going to check for that, and all this. And it's like, your job's to figure it out. It's not my job to figure it out and prove to you what I have so that you can then do the testing for it and then treat me. That's not my job. Like, you need to do it. And I understand like insurance companies like push back, but that's because doctors would like, just say, hey, this patient needs 1,000 tests, and then they didn't need them, but they'd be making an extra 50,000 a month, so they would just write up all these bullshit tests. But it's like, you need to investigate those people, not penalize the rest of us. Like, so we can't tell doctors they can't test for anything. And plus, the insurance companies want to keep making money for their shareholders, and if insurance companies recognize a new disease, like the CDC will not say like a disease is a problem, I imagine, because sometimes it's like, okay, if they do, then insurance has to cover it. And who has a great deal of influence over governing bodies? Insurance agencies. So they're like, well, if you say this is bad, then now we have to pay for it. We don't want to pay for that, because then our stock price doesn't go up. And stuff like, I don't know if that's specifically happening, but stuff like that does happen all the time. And so, but anyway, I gotta try and figure this out, because obviously I'm dying, and I don't know how much time I'm gonna have. I could barely even walk. I walked today a mile, but it was a struggle. Like, my knee and my ankle hurt so bad. But I was going off my neck. I was like, if my neck's okay to do it, I'll do it, because I'm atrophying, and I'm like, I was 147 pounds, and I need to gain weight. I need to maintain muscle, and as long as I'm not hurting my neck, I don't really care. I don't really care about my ankle that much. Um, like if my spine was good and I was just having shoulder problem, like if my neck was just good now and I fix that, I'd be like, okay, this is still a serious thing I need to pursue and figure out. Because I wouldn't be like, everything's fine now. I'd be like, okay, I'm still on my path to dying. Like, but at least I can do stuff. Use my computer or, you know, go swimming, go weightlifting, do all this like physical therapy stuff to like counteract the damage that's being done to my body. But I would still have spinal problems and stuff like that. So that's really scary. It's like I don't know what to do. I don't know how to treat Lyme's. If I do have it, a lot of tests that come up for it, um, they you'll get negative tests, and meanwhile you have like Borrelia or whatever it's called, like in your joints or wherever the problem is, and it's doing damage, and that you don't have antibodies for it. I guess I was watching a video about it, and they were saying like it's quote unquote hiding, which means the immune system's not seeing it to respond to it, which is why you can go to a rheumatologist and they can like test, do you have like elevated antibodies, right? And they don't see that, and they're like, okay, I don't see any kind of immune response, right? So what's an infectious thing that's causing problems, like, so I don't know. So yeah, it's very scary. Um, it's not like so much I'm afraid of being dead, but I mean at this point I don't care anymore. Uh, but but suffering, like nobody wants that. Like there's worse things than dying, and that's suffering horribly for months and months and years. And it's been well, I guess 2.5 years of this now. I've been dealing with this hell, and it's getting worse. Like my neck's been improving because of the treatment with that, but like the rest of my body has been getting worse. So that is very concerning because, especially like my upper back and my lower back, uh, those are very sensitive areas. Obviously, your spine is very important. Like if you bust your elbow, that's kind of a bummer. But if you bust your spine, that's a major life-changing problem. So that's a joint I'm really concerned with. And obviously, if my knees and my ankles have problems, and my hips, thank God, they feel okay. But like my knees and my ankles are not feeling okay, and I might end up in a wheelchair, and then I mean currently I can't sit, so that would mean I wouldn't be mobile anymore, except for like going to the bathroom. I basically could, I guess, go to the pool and work out. I wouldn't be able to go for walks anymore. I don't know, but I don't see myself getting out of this anytime soon. Even if PICL fixes me, like I'm gonna be in bad shape. I really hope it does help a lot. I think it's promising because like I am strong. Like the PRP did have, like I feel a lot stronger all over my neck, except for right at the top where they don't treat you, because you can't treat there unless you get PICL. So I think if you just had PRP, not even stem cells, but if I had PRP in the alar and so on, I'd be feeling much better. Like I'd be doing a lot better. And I could get PRP in the rest of my body too. I wouldn't like if PRP was covered by insurance. I'd be like hit my knees, hit my ankles, while I'm trying to figure out Lyme's disease. At least I can keep regenerating the connective tissue. But as it is now, it's like I can't afford that. I mean, the only thing I could do now is like give blood and hope like donate plasma for money, and then also get GoFundMe money and insurance. I mean, not insurance, disability. So yeah, that's what's going on.